everyone, Elizabeth Scala here, chatting with you about recovering from elbow surgery. I have had elbow surgery. I had it in August of 2020, and this video being recorded in June 2021. It's been about 10 months since surgery. I had a very complicated recovery with complications, increased pain, more pain than should be anticipated in elbow surgery, rehab, and healing. And so I had a lot of trouble. So I'm here to talk to you. And all of these videos, with all these videos, my intention is to help you, give you tips and insights as to what may come in your healing journey. Every single human being is unique and special, individual. And so what I share with you is from my journey and my perspective. And as I said, I'm only trying to help kind of inform you and prepare you up front for what could happen. What I talk about may not necessarily happen to you, and what I share, you may never need or want or have occur in your life. But again, my only intention is to help. So as I mentioned, I had a lot of complications, and one was related to increased levels, above normal levels of pain. I was attending occupational therapy. You may call it physical therapy, similar. But I was attending therapy sessions 3 times a week. I was also assigned at-home exercises that I would do outside of therapy time. And it was suggested or recommended to me to do those every hour while awake. I didn't have to wake up in the middle of the night to do those. I did the best I could. Sometimes I probably skipped an hour. Many times I skipped an hour. But I was very dedicated to that regimen. As I mentioned, I had surgery in August. And in September, what I just shared with you was my daily routine. Hourly exercises at home, 3 times a week physical therapy, life of trying to get my elbow to move. Towards the end of September, I had a 1-month follow-up visit with the surgeon who performed the operation, and he was highly concerned with my increased levels of pain. He was concerned with my increased levels of pain, but he could not, did not, or would not do anything about it. Rightly so, in today's world of opioid addiction and the epidemic related to heroin, surgeons, at least here in the state of Maryland, and at least in my surgeon's case, this is what he told me. I didn't go up and fact-checked him. But he said he was only permitted to prescribe me the pain medication that he was prescribing for only 3 months after surgery. So if surgery was August 14th, September, October, cutting it off November 14th. And frankly, while he did refill my pain medication prescription twice, at the 3rd time, he changed the medication to something that was much less effective and did not help at all. In fact, I stopped taking that medication. And to be honest, he started making me feel like I was begging him for pain pills. In fact, I felt sort of like a drug addict towards my surgeon, my drug dealer, begging for more medication. And he would not prescribe it. He recommended that I go out and look for a pain specialist. Additionally, at my 1-month follow-up visit, because of my increased levels of pain, because of my lack of movement in my elbow, it was stuck at 90 degrees and not really moving very well, he referred me to an interventional pain specialist. And I thought, okay, pain specialist, this person's going to help me with my increased levels of pain and, help me get these prescriptions that I need and monitor them so that, of course, I don't get addicted. And I will tell you, I told the surgeon at that 1-month follow-up visit, I said to him specifically, because I wrote this down, I said to him, "Doctor, I noticed that when I take the pain medication, I'm actually able to be active. I'm surprised the pain medication does not leave me sleepy or groggy or knocked out. In fact, it relieves the pain in my elbow. I feel like my pain level decreases from an 8 out of a 10 to a 4 out of a 10. And I'm actually able to get up and do laundry, walk my dog, cut food and prepare meals, do things around the house. I literally said that to him at the 1-month follow-up appointment. His response to me was, "That's concerning. It's very concerning to hear that you are able to function well on the pain medication." Did he want me to take a pain pill and then knock out and fall asleep? I didn't. That's ridiculous. Okay, neither here nor there. So at the interventional pain specialist, which I was sent to see so that he could assess these levels of pain and ultimately diagnose me with something called complex regional pain syndrome, CRPS. I'm not going to talk all about that in this video, but I can have one in the future. He diagnosed me with CRPS, so a pain syndrome in my elbow. And I thought, gee, this is great. Now I'm going to have a pain doctor who's going to help me with monitoring and alleviating this pain, and he'll be able to prescribe pain medications if I need them. Because again, I didn't share this, but I am not into taking pills. I barely take a pill when I have a headache. I drink water, I take a rest, I eat something. I try to do things naturally before jumping right to medication. I'm not on any standing, I'm on Neurontin now for pain, but I wasn't prior to surgery on any standing medications, and I barely took pills even for a headache. So my need for pain medication for my elbow was truly a need because it was really physically painful. Well, the interventional pain specialist said to me, "No, Miss Scala, I don't prescribe pain medication. I am going to conduct nerve blocks in your neck or armpit that we will do for your CRPS." Again, another video. So no surgeon prescribing me pain medicine, no interventional pain specialist providing me pain medicine. And so I took matters into my own hands, which is what I want to share with you as a suggestion that you consider doing after your elbow surgery. This is a good thing to do even if you don't have increased levels of pain, because this is something that you could bring physical data to appointments with you to tell your providers what's going on. So I started a pain log. I literally, every single night, actually I wrote it in the morning after the night, because the night I noticed with my particular case in my healing, the night was the most difficult for me and my elbow. So I would write down when I took pain medication, what time I got into bed, what the pain level was during the night, if I woke up at all during the night to reposition because of pain, to use the bathroom, to get more medication if needed. So I would write that down, and then I would write down what time I woke up. And then I would write down my pain levels throughout the day, as well as once I started going to those nerve blocks that I kind of quickly indicated I had, I started writing down everything that happened in each nerve block. It's important to have the data from the past at your present when you're in the present at a doctor's appointment. Because if you just tell him and you're sitting there and you're like, "Oh, I think it was, my pain's been like this," or, "Oh, I remember that other day when when was that?" I'm here to tell you that when you start kind of not remembering or thinking back, providers lose interest. They stop listening. They don't really, care about maybe it was a 5 out of 10. If you have physical data, real proof, handwritten or typed up notes about pain day after day, time of day, and I even wrote pain 7 out of 10, had to go to the bathroom and reposition, took a pain pill at 3 a.m., fell back asleep, woke up at 7 o'clock, heard Drew leaving for work. Drew's my husband. Pain 3 out of 10. laid in bed reading until 8 o'clock. I mean, if you tell them my pain was a 7 out of 10, I took a pain pill and it went down to 3 out of 10, and you have that hard proof written down data, that's facts. That's information. That's numbers. That's what providers listen to. So I'd encourage you to consider keeping a pain log or a pain journal, as they're called, writing down the pain level when you took a pain pill, what the effect was of the medication. Did it help you? Did it not do anything at all? Did it hurt you? Writing down with activity what your elbow feels like pain-wise, writing down at rest what it feels like, as I said, through the night as you're repositioning yourself when you're trying to sleep, where are your pain levels then? So I literally have every single night from September 22nd, now don't get scared because your healing journey won't be that long, till March 23rd. That's right. I literally wrote down all of that data. So advocate for yourself. Speak up for yourself. You are the most important person in this group of people trying to help you get better. You are. So bring the data of your pain numbers to your provider and bring your pain log to show them the exact information. Questions? Leave in the comments below, or comments on if you've tried this and it worked for you, didn't work for you, or if you tried something else that helped you monitor your pain. Would love to hear that. So thanks for watching, and we'll see you next time.